Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone.
Good evening, everyone.
Oh, I'm
Good
getting echo.
evening.
Go ahead and grab that while I straighten out my echo issues.
Good evening and welcome to Pause for the Truth. We're a little late tonight, but you know how technology goes. We have some technology snafus, but nonetheless, we're here. And if you haven't heard, there was a hurricane last week and it was pretty devastating for so many people. So before we get started, I'd like to extend my condolences to those who lost family and also extend my prayers and support, emotional support, if you will, for those who are devastated by the storm and lost their homes and just not, have to pick up the pieces in terms of their livelihood and lost businesses as well. So have to get that out of the way first. That was laying on my heart tonight, and I wanted to make sure I mentioned that. But it's a wonderful evening. We have a special guest, but before we introduce her, let me bring in my co-host, who hopefully he's not echoing anymore. How you doing this evening, Dr. Kane?
Well, you're gonna tell me I don't think I'm echoing anymore.
No, you're fine.
And good evening, everyone. I extend a good morning myself.
It's happening, Dr. Kane.
He's echoing again.
It might be both of us, Tyrone. I don't know. You tell me. It is. So Tyrone, our
I'm
technology.
hearing the echo on my end.
The technology wizard may have to magic tonight, Tyrone, and help us figure out what's happening.
What about me? Am I still echoing? Yes, I am.
Yes.
Well-
Dr. Shepherd, do you speak? Let's see what are you echoing?
I don't
Say
know.
something.
Tell me.
Yes.
Oh, yeah.
Yes.
Yeah. I hear
You're
it.
all echoing, Tyrone.
So the wizard behind the technology will have to. It seems to happen when he is logged on. He is muted. Is unmuted. So we're going to go ahead and proceed. Joining us this evening is Dr. Jasmine Shelford, a local podiatrist here in Northeast Florida. How you doing this evening, Dr. Shelford?
I'm well. Thank you guys for having me.
Oh, absolutely, absolutely. And I have to give a disclaimer. No, I won't give a disclaimer. I'll let it come out during the conversation. But listen, Dr. Shelford, when I was telling people that we were talking about foot health, they were like, "Oh, okay." I was like, "Yeah, it might not be an exciting subject, but if you can't walk, then you have plenty of issues, right? And if you've ever had any foot pain, it's not a pretty thing." So, Dr. Shelford, let's start out by telling folks about yourself and what made you choose the field of podiatry.
Well, I grew up in Norfolk, Virginia, military brat. I was born in Hawaii, then my parents we moved around a little bit, and we settled in Virginia. I went to. I'm echoing again. I went to Virginia Commonwealth University for undergrad, and then I went to Barry University for podiatry school. Did my residency at Wyckoff Heights in Brooklyn, New York.
But
you've been somewhat of a
And
city girl.
I started practice. I didn't hear you.
I said you've been somewhat of a city girl, New York, and
Yeah.
From
From New York.
You're training at least.
Yeah, from New York. I practiced in Newark, New Jersey. And after that, I said I want to move back to Florida. So I moved down here and I joined my friend's practice, Total Foot Care Wellness Clinic here in Jacksonville. I've been here, 5 years now?
Cool.
But Dr. Kane, I don't know if you missed the part where she said she was born in Hawaii.
Yeah. And like if I was born in Hawaii, I probably never would have left. But but I caught the part that said she was a military brat, so she had to follow Uncle Sam's direction, whether she
Right,
wanted to or
right.
not.
So
Right, had to follow the
Sheffer,
orders.
yeah, really. So Dr. Sheffer, let's start out by talking about what are some common myths that about foot care that you have to tell your patients when they come in. Oftentimes if we, growing up, we may have heard about some old remedy or salves or all kind of stuff that we could add to our foot. So what's the most common myth you have to debunk with your patients? Anything comes to mind?
The first one is I don't have a foot fetish. Okay. But no, one of the most common is if you lose your big toe, you lose balance. We know balance is controlled, equilibrium is controlled by the ear. You're still able to ambulate without balance issues if you have to have a big toe amputation for any reason.
Yeah, I remember when and I've spoken about it, Dr. Shelford, in the past, when my great grandmother, when she started getting, I think she started with a big toe and then the rest of her toes and then her foot. Right. And then the other foot and her legs. And it was pretty awful. It was just a memory that unfortunately as a child, having a strong matriarch in the family and then to lose that, actually, yeah, she was my dad's grandmother. But to lose that, to watch her health just change as a result of it. And I often wondered what the issue was. And as I got older, and particularly as I went to college and started learning more, I wondered, nobody ever told me, but I wondered if it was related to diabetes. So what are the more common foot ailments that people have, and are all associated with diabetes or not necessarily?
Oh, not necessarily. I have a lot of patients. I treat the diabetic foot. That's one of the most common things we treat. But people have everything in the foot that's everywhere else on the body. And I mean, nerves, arteries, muscles, bones. So we treat neuropathy, which is nerve damage. Yes, you can have diabetes and get neuropathy, but there are other reasons you get neuropathy. Echoing again. I'm sorry.
Let's Tyrone open his back up.
Peripheral vascular disease, which is arterial disease. A common one is arterial disease. Another one is venous disease. So we treat an array of things in relation to those things. Trauma, fractures.
There's a multitude of things that can affect
a multitude. Yeah.
And, no different than the hand, except you can choose sometimes to put an arm in a sling and not use the hand necessarily. But when it comes to those foot sisters, or those feet, when it comes to those feet, you're not going anywhere unless you use them.
Right.
But how do I know if my foot pain is something serious or just some temporary soreness?
Beg your pardon? What was that?
How do I know if my foot pain is something serious or just temporary soreness from standing on my feet too long or kicking the dog or something?
Rest.
Is it a valid question?
If you rest and you still if you rest and you still have problems, you probably need to go get it checked out, because pain is the number one thing that tells us something is wrong. I tell my patients all the time, listen to your body. And if you can feel pain, you're fortunate. Like I mentioned, patients with neuropathy, they can't feel pain. So their body can literally break down and they have no idea. And then they end up in my office with a big wound that's infected. And the next thing you know, we may have to do long-term wound care or even amputation.
Let's focus especially for a second on diabetes. Ms. Turner mentioned something when she started talking about, when she mentioned her grandmother getting amputation started with the foot, with the toe, and then half a foot, and then the rest of the foot, and then it goes the ankle. I call it the Jacksonian march. Some of these people just keep going right on up the foot. And sometimes that may not be necessary when you got adequate care, early care. And so with diabetics, one of the things we like to warn them of is that you may lose a sensation in your foot. It ain't just diabetic, but especially diabetic, particularly the African-American population. You may lose a sensation in your foot. So you need to look at it every day. You need to look at the bottom of the feet. And I also encourage my patients, and you can tell me if I'm wrong with this, I encourage them to wear white socks. It's not stylish, but if they wear the white socks, I can usually see if there's any bleeding or anything because they stepped on a tack or a needle or something along that line that can act like a hypodermic syringe and inject bacteria into your foot. And just imagine if I came at you with a needle that contaminated, you're going to want to shoot me. But you do that, you risk that every day when you walk around the house barefooted. So speak to us a little bit about diabetic foot awareness. I guess that's what I should say to start. Diabetic foot awareness.
Yes.
And if you can speak to us in terms of what you tell your patients.
Okay, I tell my patients, well, first I do the exam, and I show them that they have sensory deficits. I do 2-point discrimination. I put my finger on their feet. I tell them close their eyes and I track my finger. I do the light touch, touch the bottom of their toes, and they know that they can't feel. I also do hot cold. I get a pair of scissors, touch the big toe. Is this warm or cool? And a lot of them say it's warm and it should be cool. So they see that they have a problem. And once they're able to see it, they're like, wow, okay, what next, doc? And I let them know, you have to check your feet. Like you said, check your feet. As far as the socks are concerned, I tell them check their socks. I tell them check their shoes. And I'm glad that you educate them on why they need to wear white socks. Because a lot of people, they're not going to do it if they don't know why. They're just going to think, oh, he just wants me to do this for no reason. But you give it once you give people valid reasons for doing things, they're more willing to be compliant.
Gotcha.
But number one, you have to look. If you can't feel anymore, you have to use your eyes.
One of the things that our audience is both professional and layman. So someone has asked about what does a neuropathy mean? So sometimes we want to make sure we break it down to get them a good understanding. Exactly, tell people what neuropathy. You and I know what the definition are, and probably Ms. Turner because she had her education background. But if you're talking to someone in your office has no clue what you're referring to when you say neuropathy, what's the definition for it?
Okay, so neuropathy is nerve damage, and it comes in several forms. We use the term paresthesia. So what that includes numbness, tingling, burning, sharp shooting pain. And then you have the other side, which is anesthesia, where you have no sensation at all. So basically, it's nerve damage.
Right. Is it reversible or is it once you have it?
It can be dependent on it can be dependent on the cause. Every time my patients come in and they're expressing that they're having these abnormal sensations in their feet, I'm looking for the cause. A common cause a lot of people are not aware of, and a lot of the oncologists don't educate their patients, chemotherapy. We see that often. Chemo-induced neuropathy tends to be reversible, but depends on how much damage is caused.
Yeah, and the chemo is the therapy for cancer therapy, just for a few of those that don't know. But it's cancer therapy. Some of the drugs that we use can cause nerve damage. It can also cause heart damage.
Alcohol.
Yeah, I was going to say the nerve damage from cardiac standpoint is not our topic this evening, but you're absolutely right. Alcohol.
Alcohol is another common cause of neuropathy, mainly because of vitamin deficiency. For our diabetics, a lot of our diabetics think that they have neuropathy because they have diabetes. Metformin can cause neuropathy because of the vitamin deficiency as well.
wow.
Just like everything else in your body, the nerves need vitamins. They need nutrients. And if they're starved of them, they're going to start acting out. You're going to start feeling tingling. You're going to start feeling numbness. So every time my patients come in with these sensations, I'm looking for the cause so that we can find a fix and maybe reverse it if we can.
Which vitamin are we looking at? Which vitamins are
vitamin B, vitamin B, the 12-5-3, folic acid, L-6, L-methylfolate, which is the active version of folic acid.
Yeah. So if someone has diabetes, how often should they come in to see you, Dr. Shelford? Or to have
my healthier compliant diabetics every 6 months. But diabetics that have other comorbidities like nerve damage or blocked arteries or damaged arteries, every 2 months. Some of my riskier patients, I see them more frequently, just so I could keep an eye on things. And after the exam, I say, all right, I see no concerns here. I see you in a couple months.
So you all both, you and Dr. Kane both talked about, Dr. Kane gave his little nugget about wearing white socks, but, and this is for both of you, what are some daily foot care regimens, if you will, that you tell people that they should do? I know I've had people to say that their doctor told them to wear diabetic shoes or to put, I don't know. I'm not going to start quoting anything because that might be some stuff they made up. So, so if you would just kind of share some daily care for your feet, and not just, and to me, it shouldn't be for just people with diabetes. To me, it should be everybody, particularly as we age.
Right. All right. Let's start with number one: wash your feet daily. We walk around. The ground is not necessarily clean, and anything can happen. You can step on something in a puncture wound. If you have dirty feet, you're going to increase the number of microbials or bacteria that can enter the foot, causing a life-threatening infection. The clean socks are important. Change your socks daily. A lot of people, they try to cut back on the laundry detergent with the prices rising. you can't afford that. You get one pair of feet, so change your socks routinely.
That's
with
not
shoe
true,
gear.
Dr. You smell the socks, and if they don't smell dirty, you put them back on. That's the real
no,
reason.
ma'am. If they don't, no, ma'am. If they don't smell, you need to change them.
If they smell, we usually tell you they smell. Change your socks.
Oh boy, you guys are funny. Check in between your toes. Check in between your toes. I highly recommend that. A lot of times, people with sweaty feet or wearing shoes and socks for a long period of time, they could get maceration, and what that is wetness between the toes that turns white. If you wash the dishes for a long time, your fingers start to turn white. That's considered maceration. The bad thing about maceration is it breeds fungus. Fungus loves wet, warm areas, right? And if fungus get out of control, it could turn into a serious infection, or it can invite bacteria into the area. There's a condition we treat called erythrasma, which is a bacteria infection. A lot of people believe that they have fungus and they're at home using antifungals, over-the-counter antifungals, and it's not getting better because it's actually a bacteria. So you check your toes. If you see the maceration, you dry your toes out after your showers. That helps cut down on the risk of fungal and bacteria infections in the toes.
And you
make an assumption.
You mentioned something just now.
I'm sorry, I got to say this before I forget because I'm old like that. So we make an assumption that people
something's wrong with the mic. I can't hear you guys.
So people who are heavy and can't reach down to look at care for their feet, what advice do you give them? Both of you.
I heard the end of it.
Okay,
can you hear me? What advice do I give to people? Yes.
Can you hear me, Dr. Shelford? What she basically said that,
I can.
I'm sorry, you can't hear me? Yes?
I can.
Okay. So what she basically was saying that some of the old folks and some of the people that are somewhat overweight that can't bend over and look and pull their feet up to their knee and look at, what advice would you give them in terms of how to look at their feet?
I tell my diabetic patients, everyone, well, all my patients that need to check their feet regularly, get a mirror, put it on the ground, put your foot over the mirror and look down into the mirror. And then people who are fortunate enough to have someone to live with them, have a family member, friend, or caregiver look at your feet for you.
I'm gonna elaborate a little bit on the maceration that cause I see them before you do. Now you can kind of take care of it before you do, but when it get out of hand, I send them right to you to take care of that condition that I failed to do so. But one thing I tell them, and you mentioned one of it, as soon as you get out the shower, you know, and you dry the rest of your body, dry your feet as well. You know, I got these duck feet, and they be just like this, but when I hit the floor, they spread out like this. Okay, a lot of people feet, the toes do not spread out, and they trap that water in there, and then that water causes breakdown of the skin, you know, between your toes, and which is what we call that maceration. The whitish look to it, you know, it's like sticking your hand in dishwater, or when you used to go take a bath and you never got out the tub in enough time, and your mom come in there and finally chase you out the tub, and you're all white on your feet. That's kind of the beginning of some of the maceration. And that skin sometimes break down and allows bacteria to get into it. And then that's when they definitely get infected. And so I encourage them to always spread their toes apart. I show them doing my exam, much like you do, Dr. Shelford. It's exactly what I'm looking for. You spreading those toes out, you're taking a look, and then you'll tell them you're not drying between your feet. Make sure you dry your between your toes. Otherwise, it's a high risk or high risk circumstance for getting an infection. That's when you get that Jacksonian march that gets infected, and we don't be able to get into it in time enough, and they start chop chop.
So speaking of cutting, how can I safely cut my toenails to avoid toenails? Ingrown toenails or other injuries?
Okay, the best way to cut is straight across, and then you don't want to cut them too short, because if you cut them too short, you're more likely to get an ingrown toenail. So everybody's toenails are unique. I would have to see the person and show them how to cut their nails specifically, because some people need to do a triangle when you have recurrent ingrown toenails. That helps to prevent the toenail from growing in the end of the toe.
Well, one of the things I also tell patients when I send them to you, as I send them to you, is be honest with you. Some of those patients, don't you touch your toenails, because they cut too far, they cut too deep. You know, they're not cutting them correctly. And I say, I'd rather you go see the podiatrist. And if they say you're capable of a cut, and some of them got bad vision and can't really see that toenail as well as they should, you know, so you go see a podiatrist, and she will teach you how to cut your nails if she feels you can cut your toenails yourself. She or he, I should say he. You know, most of the podiatrists I got are ladies.
Yeah, and if you have circulation problems, if you're on blood thinners, if you are high risk diabetic, well, if you're diabetic, you first, like you said, consult with the podiatrist to determine if it's safe for you to cut your toenails. If you're blind, if you have neuropathy, you do not need to cut your toenails. Go see your podiatrist, have them cut your toenails for you.
Just
So I
because
have
Stevie
to,
Wonder cuts his nails doesn't mean you can cut yours.
oh, Dr. Kane, that's just so awful.
He should not.
So I just have to,
He
the
should
elephant
not
in the
either.
room, the elephant in the room, I have to ask, and we're not blasting any particular profession, but do you encourage or discourage your patients to go to get a manicure or pedicure rather, as a way, just in case, in between coming to see you, Dr. Shelford?
It depends on the patient. My diabetic patients, my high risk diabetic patients, absolutely not. Again, patients on blood thinners with poor circulation, nerve damage, absolutely not. And the patients that I do allow to get pedicures, I send them with rules. I tell them, don't let them use the cheese grater because that cheese grater is very abrasive to the skin cells, very traumatic to the skin cells, and it causes the skin to grow back thicker. I have so many women coming into my office with thick skin, especially on the heels, and it's because of the cheese grater. It's like you have to tell them stop using it. Another thing with the cheese grater, I've seen cuts. Patients come in with small lacerations, abrasions from that cheese grater, and then they get infections. So I tell them, no, tell them don't use the cheese grater, use the pumice stone. After you leave, apply an over the counter antifungal, just prophylactically to try to decrease the risk of fungal exposure. I don't recommend that they use the salon's nail polish. I highly recommend they take their own. Some of them don't want to, but that's one of my recommendations.
Why is that?
Because with the fingernail polish, you could have cross contamination. They'll polish somebody's nail who has fungus, and then they'll put that tip back into the bottle, and it contaminates the bottle. One thing a lot of people don't know about fungus is your body has to fight the fungus. And they found that there's a genetic component to people who get fungal infections where their bodies just don't fight off fungus as well. So if you already are immunocompromised and can't fight off fungus well, you're more likely to get a fungal infection from the nail salon.
You really told me something just now I didn't know, but that's one thing I do want to add.
Right.
I tell them I use a lot of discrimination about going to the nail salon. Some of it is similar to what you just described, but part of it is because they use those cheese graters or cheese grater like instruments. How much dead tissue, how much serological, bacterial, and viral contaminant remains on those cheese graters just because they dip it in that
Right. Yeah. A high load.
Yeah,
a high load. Yes.
And for the audience, just to give you an example, back in the days, and y'all remember, I think most people remember cheese graters when mama and grandma used to use. When they tell you to go in there and wash the dishes, if you just took that cheese grater and just rinsed it off in the sink, they come back at you with a switch. Because
right. Right. Yeah. They're hard to clean, even at home. Right.
So now you got
you gotta get in there and scrub.
And scrub it out. You got pieces of bacterial and serologic flesh on those same instrument that these people use on other people that may have, and not to discriminate against anybody, may have HIV, may have some other transmittable diseases, communicable disease that may be on those cheese graters. So one of the recommendations I make, and I can be to a degree, I know I can be wrong with it. I tell them take your own equipment and tell them to use your equipment to do the job. Okay,
and I totally agree.
And clean.
Yeah.
So if you're just tuning in, we are talking about foot health with Dr. Jasmine Shelford. As I said, may not be a pretty subject, but nothing like a pretty pair of feet, though, right, Dr. Shelford and Dr. Kane? Each week we feature a history maker And this is the point, Dr. Shelford, where we just want to, we pause for a moment, and our behind the scenes technology guru will feature a history maker. Don't go anywhere. We'll be right back. Drink a bottle of water or a glass of water or something. We'll be right back with you. Take it away, Tyrone.
Welcome to Pause for the Truth History Makers Minute, October 1st, 2024. Today we pause to honor a trailblazer in the field of podiatry, Dr. Tina Oliver, DPM. Dr. Tina Oliver, DPM, is a distinguished podiatry specialist based in Houston, Texas. She is affiliated with prominent medical facilities such as HCA, Houston Healthcare Medical Center, and Memorial Hermann Northwest Hospital. Dr. Oliver is currently accepting new patients, continuing her commitment to providing exceptional care to the community. Dr. Oliver's journey in podiatry is marked by a series of groundbreaking achievements. She holds the distinction of being the first African American female in the United States to become board certified in foot surgery by the American Board of Foot and Ankle Surgery. This milestone is a testament to her dedication, expertise, and pioneering spirit in a field that has historically seen limited representation from African American women. With over 37 years of experience, Dr. Oliver has made significant contributions to podiatric medicine. She offers both inpatient and outpatient consultations, ensuring comprehensive care for her patients. Her extensive experience and compassionate approach have earned her a reputation as a trusted and respected professional in her field. Dr. Oliver's impact extends beyond her clinical practice. She serves as a role model and mentor to aspiring podiatrists, particularly those from underrepresented backgrounds. As we reflect on the remarkable career of Dr. Tina Oliver, DPM, we celebrate her contributions to podiatric medicine and her role as a pioneer for African American women in healthcare. Dr. Oliver's accolades and recognitions are numerous, highlighting her exceptional skills and dedication to her field. She has been a keynote speaker at various medical conferences, sharing her knowledge and inspiring others. Her influence extends to her involvement in community outreach programs, where she educates the public on foot health and preventive care. Dr. Oliver's commitment to education and mentorship has paved the way for future generations of podiatrists, ensuring that her legacy will continue to inspire and guide. Thank you for joining us on Pause for the Truth History Makers Minute. Stay tuned for more stories of individuals who are making history and shaping the future.
You know, I actually could have took some of that and applied it to yourself, Dr. Shelford, beyond not being the first, but being a continuation of the first, in which you take the time out to take good care of especially patients that I've seen. I have no complaints, but you guys do a great job at Total Foot Care, taking care of patients and their the issues that they have with their feet. And so, while, like she said, it's not a glamour subject, but it's one that if you can't, it kept a lot of people out of the Army. Ask Donald Trump, because their feet was bad.
I just want to win a pretty feet contest, but I think I'm far beyond that, though.
Yeah, remember Eddie Murphy?
No, you have nice feet.
Oh, she just let it out. She's my doctor.
Well, you can tell them I'm your doctor.
All right. Listen, I was listening to, trust me, I'm learning, and she's right. All the things that she said, she's talked to me about, but I want to switch a bit, because I see a lot of people who have bunions. They may not have diabetes, but I see a lot of people who have bunions. What are the early signs of common conditions like bunions and plantar fasciitis and other, and when should people seek treatment? And what can they do to avoid it? I mean, you know what I mean? All of that.
Okay. All right. Let's start with avoidance first. Proper shoes. Wearing proper shoes is very important. I tell my patients always check the bottom of your shoes. For whatever reason, I know people in Florida, they like their flip flops. So they tend to neglect their sneakers and they wear a lot at the bottom. When you have wear on your shoes, that changes how you walk, and it stresses the body, your foot, in different ways that can cause progression of certain deformities. Plantar fasciitis, as you mentioned, is a stress deformity. The band on your bottom of the foot that is there to help support the arch of the foot, where it inserts into the heel, it can become stress. One of those common causes of the stress is worn shoes. If shoes are worn, you're stressing the plantar fascia, it becomes inflamed and painful. One of the most common things we treat with are custom orthotics. They're inserts that go into your shoes and they correct the alignment of your foot, offering proper support and stability of the foot. The orthotics are important because they help slow progression of the other lot of ailments and deformities that we treat, such as bunions. Bunions, they're progressive deformity. You have the metatarsal, the bone that is attached right proximal to the big toe. It tends to deviate. When it deviates, you get that bump on your side, and that's what we refer to as the bunion. One of the main causes is abnormal pressure on that metatarsal. And what the orthotics will do is correct the alignment to slow down the progression. People think heels affect bunions. That's not necessarily true. I hate when people say that.
No pointed toe shoes.
So
you hate when people say, "Well,
you're not that the heels cause bunions." That heels cause bunions. Heels do not cause bunions. 90% of the time, you have a bunion because someone else in your family had a bunion. Bunions are hereditary 90% of the time. The other 10% can be from trauma and biomechanics. And that biomechanics is what makes our profession unique. Biomechanics is how your foot operates during the gait cycle when you're walking. A lot of people, they have abnormalities. It's a lot to the bunion. And if you have a bunion, come see me so I can get specific and tell you your reason why you have that bunion. But
to sum it up, it's a wide level of variability in terms of causes of bunions and also the treatment of bunions. And there's nothing that's one size fit all in terms of explanation. So that's why they need to see you. Because even I have been given wrong advice. I've been giving wrong advice or explanation as to the bunions. Because I thought high heel shoes, while ladies' legs look great in high heels, they were too good for footwear, and thought that they may be a large a large contribution to the causes of these abnormal feet problems, bone problems and stuff. So straighten me out about it for sure, so I don't lie to my patients no more.
Yeah. I mean, bunion will the high heel shoes will aggravate the bunion, but it's not the cause of it.
It's not the cause. Okay.
Can I give you my mom's phone number? You can tell her that.
Okay, I got you.
She said, "Baby, you see how my feet are. You don't want yours like that. You better stop wearing them shoes." I'm like, "No, baby, it's the fact that I'm your daughter is why I have
exactly.
Is more the issue." So is it safe to remove corns or calluses at home, or should that be left to a professional?
Yes, please see a professional. And when I say professional, I mean a podiatrist, because your
not the nail salon.
They're not certified in callus removal. I'm glad you mentioned the callus. A lot of people tend to use those callus removals. I hate them. because they damage the skin. And a lot of people think more is better. So I have a lot of patients that leave that callus removal on their skin for a longer period than the box instructs. And then they end up with ulcerations.
That
So
sounds like another issue.
my recommendation is to stay away from the callus removal. Go see your podiatrist. The callus that are on the bottom of your feet, most of the time we can't do anything for them. Patients come in, I want to take this, I want you to remove this. If I remove it, it's going to come back. Or I want some surgery for it. Callus, they come from abnormal pressure, right? And if we change your pressure point in one area, you're likely to get increased pressure in another area, which will cause a transfer lesion. So I tell most of my patients, if the callus is on the bottom, you're likely going to have it for the rest of your life. It's palliative care. You come in routinely, we shave it off to offer you the most comfort.
And that's the difference between that and a plantar's wart, right?
Absolutely. Yeah. A plantar's wart is it looks like a callus, but it comes from a virus.
So Dr. Kane often speaks of having a geriatric patient population. As he's gotten older, his patients have gotten old. They've gotten older together. Are there any particular issues that we experience with our feet as we age? And what advice would you give people just, as to aid that to be a healthy experience for their feet?
Yeah. I highly recommend all geriatric patients to get a podiatrist. The foot changes over time. Your deformities increase gradually over time. There's a lot of negligence because you can't see as well anymore. You can't reach your feet anymore. So I highly recommend that every geriatric patient adds a podiatrist to the group of doctors they see. And I know they hate seeing so many providers, but it's necessary to prevent amputations or other life-threatening issues.
Well, in my family, I'm not going to call my relative my mom. She believes in
I hope she listening.
Soaking her feet. And,
she does or she does not?
She does, in terms of soaking. It used to be the Johnson's foot soap that she can't find anymore. So I don't think they make it anymore.
I wonder what happened to it.
So,
I wonder what happened to it.
The other Johnson got rid of it.
What advice would you give people to, what are your thoughts, both of you, about soaking your feet for good foot care?
It depends on the patient. It really depends on the patient. I recommend everybody seek professional advice. If your doctor tells you no, they'll provide you with a reason why you should not soak your feet. But there's a time limit on soaking your feet. I don't think anyone should soak their feet longer than 15 minutes.
Okay.
And then also, patients need to check the temperature of the water. We treat a lot of burns from people soaking their feet. It's risky, and that's why I advise anyone to seek professional help or a consultation to determine if you're a candidate to soak your feet.
Let me add just one caveat to that, because you mentioned it, you're absolutely on the mark. Those guys who may have neuropathy and can't feel things necessarily, to put your feet in a bucket of hot water that you cannot gauge the temperature of, literally means you may be boiling your feet. So don't soak it.
We treat a lot of burns
in hot water, especially in hot water. Do not soak it, because you may not be able to gauge what the temperature is or how hot is too hot for your feet. And now we're treating second and maybe not third degree burns, but at least second degree burns.
First and second for sure.
First and second.
Yeah.
So there's a question.
Absolutely.
Okay.
And ice water as well. Okay. Ice water is risky as well because of frost nip and frostbite. Right. So
I never done
get a consultation.
I never done that, so I didn't think about the ice water part. It's like, yeah, who soaks their feet?
Yeah, people do. You know, your patients that have inflammation, they tend to soak their feet in ice water. I had a patient come in today. He had neuropathy, and he's telling me he's soaking his feet in ice water. And I'm like, sir, I don't recommend that. You should not soak your feet at all. You can't feel anything.
Wow.
So in that case, that's foot care. That's poor foot care behavior with him.
He's creating
neuropathy.
He may be creating damage beyond the damage already done.
That's so sad that you can't feel it. You walk around and, oh my goodness. So that sounds like proper footwear then is important if you have neuropathy or if you have diabetes. So do you give advice? I know that some insurance companies does cover you get a prescription for a pair of shoes, but obviously people want more than one pair of shoes a year. But what do you give any advice to people on the best type of footwear that they should wear?
Wait a minute, let me answer the first part.
I do.
Let me answer the first part. I don't, because that is a specialty for the podiatrist. So I'm not about to try and recommend what type of shoe to wear. I send them to the podiatrist. They tell us, me and the patient, what type of shoe they need to have or need to use. And then I follow that podiatrist advice because they are the expert in that field. But so I'm sorry for the interruption, Dr. Shelby, but I thought that I want to make sure my patients know exactly why I don't waste time telling them what shoes to wear because I don't know what shoes to wear. I'm sorry.
Right. Yeah. So that again is patient specific. To mention two of the most common foot types: your flat foot and your cavus foot. The cavus foot is the foot with the elevated arch. I don't know if you've ever seen anyone that has a high arch. That person has a cavus foot. And so depending on the deformity that they have, I'll make my shoe recommendations from that. And I do have specific brands that I like because those brands support those type of deformities. But they're patient specific.
I tell you what, my shoes that I got from Dr. Shelford, I'm doing a commercial. I wear my shoes every day and no, they don't match my clothes. So if you see me walking around with the same shoes every day, I love my shoes. Dr. Shelford, there's a question about shoes for large men where there are a few options. What's your recommendation?
Large men, as far as weight?
Yeah.
Okay, weight.
Or height.
Okay. So
size 15.
Wow.
Large shoes. New Balance tends to make a very supportive shoe, and they typically have the larger sizes. One of my favorite brands to recommend, Brooks. I think they have large shoe sizes. But I would need to see your foot type to be more specific on which what do they call the design? Because every brand has several shoe types, so I would need to see the foot. If there's a flat foot, you want something. If you have a flat foot, you want something that has great arch support. You look at a shoe, you hold the front and the back of it. If it collapses on itself, that shoe is no good. The toe should only bend. I should pick up a pair of shoes. Hold on.
You want me to take mine off, Dr. Shelford, and show her mine?
No. We might sell something.
So and this is what I mean. Only the front should bend.
Gotcha.
So Dr. Shelford, can foot health issues contribute to knee, hip, or back pain? And if so, how?
Absolutely. So again, biomechanics, depending on how your foot is shaped, the position of it, like with your flat foot, you have excess of pronation, meaning the foot turns down, right? So when the foot turns down, you're jamming the ankle. The leg is also rotating, so you're jamming the knee and the hip and the lower back. Yeah. And then
Well, I'm
different
all broke
deformities,
down.
same
I'm all
thing, but
broke
opposite.
down.
It could be opposite. Yeah.
Listen, I've
A
had
lot of
flat
people
feet
who
so
have
long.
knee pain. Go ahead.
Yeah. Go ahead,
A,
Dr. Shill.
a lot of people who have knee pain, hip pain, or back pain should see a podiatrist as well, because they'll likely benefit from the orthotic, the insert that we provide that's customized to their foot to correct the alignment.
And I take that in consideration, especially if they complain about a knee or hip pain, and I find nothing going on with the knee or the hip. I send them to podiatry and say, and with the explanation of patient with a lot of knee, hip pain, please evaluate for proper, I think I use the term pronation or something like that, for a proper footwear to see if it's contributing to the cause of the hip and knee pain.
Right.
And that's all I can, at that point, shove it on to you guys and let y'all figure it out, because I don't know.
Right. And a lot of times the only thing we'll offer them is the custom orthotic to help correct the alignment.
Cool.
Dr. Shelford, are there exercises or stretches that can improve foot health and prevent injuries?
Absolutely. Absolutely. Depending on the problem we have stretching exercises or strengthening tips. Absolutely.
So
Now,
basically,
your muscles, go ahead.
No,
Your
you go ahead.
muscles, they have tendons. Yeah, your muscles have tendons that insert into the foot, and those muscles, they alter your gait. So sometimes you have weakness in certain muscles that you need to strengthen. We give you exercises for that. Sometimes you have muscles that are too tight that are contributing to your foot pain. When I mentioned plantar fasciitis, a lot of the times the posterior muscle group, the muscle group in the back of your leg, is too tight. So with it being so tight, when you're walking, you're stressing the plantar fascia, and that can cause inflammatory pain.
Let me ask a couple of questions, and they both somewhat connected. So, a lot of sports activity, especially our young folks, okay? Because us old people ain't doing as much sports activity. But a lot of sports activity is occurring with these younger folks. And so there's potential for foot injury. The injury may be as a result of already some other issue going on with the feet that they may need some correction to. And the other part winds up being, is there any particular advice you give the parents about having their kids' feet checked out or examined either before participating in sports or while they're participating in sports, just out of curiosity?
Right. Right. I love my overprotective parents that bring their kids in because they want to check them out before they start playing sports. Because if there's an issue and we get them into orthotics early, that could prevent some problems down the road. There's a big controversy with treating pediatric flat foot. A lot of times the children, they have flat feet that they inherit from their parents. And you have a group of professionals that don't believe it's necessary to treat if they don't have pain. And then you have a group of professionals that do think it's necessary. I fall into the group that thinks it's necessary because the flat foot causes a lot of stress on the joints above, the ankle joint, the knee, the hip, and the lower back. If I correct the alignment early, that could prevent arthritis down the road. Like a lot of people who have to have knee replacements because of a flat foot, that could have been prevented early on. And if you're an athlete, that's more wear and tear on your body. So those things are likely to happen sooner.
And that's not even wear of the joint of the knee when you have a foot pronating or whatever on one particular direction and not putting the stress across the entire knee, but just one part of the knee. Is that reasonable to say?
Yeah, yes.
Now, and I'd have to ask this because I have one of my kids. When it comes down to when they're young and layman's term, pigeon-toed, if you recall that term, where anyway, is there any advice? Because a lot of parents may be asking about it. I see a lot of people when they get much older, they either very bow-legged, or sometimes somewhat pigeon-toed or lap need, as they call it, or lap anything, you can comment on any of those conditions to help parents understand why they may need to bring their kids in to see you or a podiatrist earlier than.
Yeah, again, like we said, you're putting extra stress on these joints. They need to see a professional early to determine the cause, because it could be coming from the hip, where the child may have a dislocated hip, and that's something you need to treat right away, because they could develop what we call hip dysplasia,
Yep.
or even necrosis, and necrosis is where the bone dies.
Right.
And if that happens, it's going to change how your child walks.
Yep.
And, we want to protect our kids. We want to, an abnormal gait could be traumatic for a child, psychologically and physically.
Yep.
So as soon as you see something abnormal, go see a professional, because there's something that we can do. If it's in the foot, we'll get them into corrective devices, whether they're what we call ankle foot or orthotics, bracing, or just simple orthotics to go into the shoes. Or we may have to refer you to an orthopedist if it's coming from the hip or a joint higher up.
But so you said something that sparked another question. So you said if your parents see something abnormal, then bring them to see a podiatrist. What about,
right?
Because they bring them to see me for a routine physical exam. They didn't see anything abnormal, but they wanted to make sure that their kid can participate in sports. There anything such within your profession as doing a preventative exam in kids that are anticipating participating in sports, or are getting ready to participate in sports, whether it's football, basketball? Should there be any preliminary exam? I know we've done it for years without it, but we also had years of injuries that might have been able to be prevented if they had had preliminary intervention from a prevention standpoint. So give me an example or a circumstance whereby that might be applicable. Or is it your advice to maybe have parents to come in and see the podiatrist at least once before their kids start participating in sport, to have their feet exam?
Yeah, I think that's a good idea. It's not something we do routinely. So I think you might be on to something. Look, that's something I might need to start marketing. I think you're on to something. Yeah, what we call an annual podiatric exam. You might be on to something. Yeah, but it's not something we do. We do in any. I don't think in any profession. Do you tend to do that regularly?
When they come in and they ask for a routine, if they come in and ask for a routine physical exam, obviously one of the first things I want to make sure of is that their heart is okay, because that'll take them out.
Right.
Them down.
Yeah.
Once I get past that, I'm be honest with you, no. But listening to you this evening, I'm going, and I've seen some ugly feet in these kids. They be on one of those Eddie Murphy movies.
Yeah.
And I've seen some bad looking feet, and I think that they should, and I should have recommended them to go see a podiatrist. And I wished I had them, looking back. But now, looking forward, I will be sending them just to have the podiatrist take a look, so they can have the best, be in the best position to come out of those sports. Because, only less than 1% of our athletes make it to the professional stage anyway. And so those other 99% of those athletes, they're going to be left with lifelong trauma should anything have occurred as a result of defective, I want to say defective feet, but defective feet.
Yeah, I agree. So I mean, maybe when the parents bring them in for those sports physicals, one of the referrals you include should be to the podiatrist. I see a question someone is asking about insurance covering. Every plan is different. most insurance cover you seeing a specialist. I fall under the specialist category. So your copay is going to be a little more to come see me, but most plans cover a podiatrist.
And I will add to it as a primary care, because I'm the guy to refer them, that we can be very creative in terms of taking care of our patients.
Yeah.
So get creative, guys, and let them get.
We know the language to use to get things covered.
Until I find one of those universal phrases that will fit, get creative and think about your kids, because when you're taking care of them, they are your kids. You know, even though that you're not their parent, they are your kids when you're taking care of them from a healthy standpoint. So get creative and refer patients, you know, to the podiatrist to have their foot examined.
Yeah.
I'm going to get creative and start figuring out the best language in order to be able to do so. I get rejects, I just modify them, and then I go ahead and go ahead.
I think the most common diagnosis I see is congenital deformity with the pediatric patients.
So we can rule out a congenital deformity in terms of when I send them to you or any podiatrist. When I send them there, we can rule out a congenital deformity because of mom could have told me her dad had some bad feet, whatever, you know. And so genetically, we're looking for this, that, or the other. So I think that's a good idea, and that's something you and I need to talk about, and we're going to work on.
Yeah. I like that. Since we are on the pediatric patients,
go ahead.
Yeah, we were talking about insurance coverage with podiatry, and I was just saying that most plans cover specialists, and I fall under that category. And then Dr. Kane was saying sometimes we have to get creative with our referrals and the diagnosis we use.
Yep.
From the
since we're talking about
the
pediatric with getting it covered.
Okay.
The referral covered or approved.
Well,
but since we're still on the pediatric patient, some advice I want to give to the parents. It's just simple. Look at your children's feet. Recently, we've been seeing an increase of bone infections in pediatric patients from ingrown toenails. From ingrown toenails. A prolonged infection from an ingrown toenail could lead to a bone infection because the bone is so close to that nail. And a lot of these children, they don't tell their parents that they have an infected toe. It's my boy patients. They hide the toes because they don't like pain. They hide their toes from their parents for weeks, for months. And then when the parent finally sees it, they come in with these huge toes, swollen, infected. And a lot of this, we've been seeing an increase in infections. And the standard of care for a bone infection is amputation or long-term IV antibiotics, depending on how bad it is. So, it's limb threatening. So my advice to all parents, routinely check your kids' feet.
And get them in early.
But the second part of that, Dr. Shelford, so if they look at it and they see something that doesn't look right, should they take them to the pediatrician or come and see you?
You could take them to the pediatrician first. Most pediatricians, they start them on antibiotics and then refer them to us for removal.
Well,
they need the antibiotics as soon as possible.
And to address what you said about the boys, we're being very macho in terms of how we do things, and it may not seem very manly like to complain about a foot issue. It's just men.
No, it's not macho. Men can't tolerate pain, and they're afraid of the pain. My male patients, when they come into the office, they're never macho. They're crying. They're crying and scared.
After the pain hit them, it takes away the machoism.
Yeah. That by the time I see him, the macho man is gone.
Macho man gone.
Yeah,
No,
it's pain. They're afraid of the pain.
I said that as because sometimes these kids like to hide. These boys like to hide what's going on, and and hide the fact that they feel pain. But when that
Yeah.
pain hits them just right, like Richard Pryor said, you want to cause some pain, put on a pair of shoes, put a person on a pair of shoes. Of course, he used the N word, but put a person on a pair of shoes that are 2 sizes too small. And if that can cause a lot of pain, because I've worn shoes that were too small and I could not fit.
Well, Dr. Shelford, this was an amazing conversation. I've learned more about the foot than I care to. I think the thing that's been most hurtful is going to the nail salon and dealing with the fungus on your finger. Oh, it's not about me. I'm sorry. Anyway, thank you so much. Thank you so much for your expertise. I think our audience gained a lot of information. And as Dr. Kane mentioned, some of our audience are local physicians. So hopefully, if they didn't know a good podiatrist to refer to, they'll now consider you. Before you get off the air, we would like to give you an opportunity to first tell folks how do they reach you if they are in need of a podiatrist. If you can put your contact information in the chat, and Tyrone will post it on our website. But if you also wanted to verbally say it, and then share your final thoughts. Maybe we didn't discuss something that you wanted to, I should have mentioned whatever, or just what are your final thoughts about tonight's topic?
Can you repeat the last thing you said?
What are your final thoughts about tonight's topic? Your final thoughts about tonight's topic.
Okay. First, thank you guys for having me. I had a good time. I enjoyed it. Again, it's vital that everyone check your feet daily. There's so many things that are missed because we use our feet every day. We take them for advantage. You get one pair of feet. They don't grow back. We can't transplant feet as of yet. So look at your feet. You see a problem, reach out to your primary care doctor or to us directly, and let us decide that there's nothing wrong. Okay. We want to keep everybody in Jacksonville healthy and on their feet. To reach me, I work for Total Foot Care and Wellness Clinic. I will send our information, our phone number and address. Well, we have several offices. I'm currently at the Dunn location and at the Intracoastal location, close to the beach. But we have several offices. We have a ton of great providers, specialists in everything: wound care, foot trauma, sports medicine, the diabetic foot, and we're here to keep Jacksonville on their feet. So thanks again, guys. I really appreciate the invite.
I love that, Dr. Shelford, to keep Jacksonville on their feet. That's pretty cute. Did you just make that up?
Just made it up.
You need to send that slogan to the Jaguars.
Thank you so much for joining us. Dr. Kane, what are your final thoughts regarding tonight's topic?
I'm not going to hold people long. I can get winded. But what I will want to say a couple of things. I think she did an excellent job in terms of helping us with understand better about foot care. I think we did her a disadvantage in terms of not letting her know that we can get it pretty in depth into the subject matter. So we want to invite her back. And this time she can't bring back any audiovisual aids she may want to use. And we can put it up on the screen because a lot of times that's the best way to explain things when people see the audiovisual aids. Okay. I think that as far as sports medicine is concerned, I think for sports medicine is concerned, it ain't just for the kids, but I think that those wannabe athletes that play, intramural football and do things like that, they should pay attention to what's going on with their feet. I think people should also have the proper footwear, even just walking around the house, making sure that they wear some footwear that extend beyond the toes if they're going to wear flip-flops or they're not flippity flop. they have the bottom of them at least firm enough in case you kick the side of the bed by mistake when you're trying to get up at night. You don't break a toe. So have at least an extend be a half an inch beyond the toe so that it hit the shoe instead of your toe.
Yeah.
And the I think that's pretty much what I like to see. The other thing is Total Foot Care, and she may not want me to say this, but they are African American, pretty much owned, but they don't just take care of African Americans; they take care of everybody. But I like the idea that they pay attention to people that look like me and y'all. So, and give them fair treatment. They don't only just take care of people that look like me and the rest of you guys, but they are very aware of issues that affect African Americans and the culture behind why these issues may be occurring. So I think you guys should really pay a lot of attention and look at if you're satisfied with your current podiatrist, great. But if you haven't had one or need one, check them out, because I think you're going to get excellent foot care. I have no complaints about any of the patients that I've seen.
Thank you, Dr. Kane.
And before Ms. Turner, one thing, and I know it's about foot care, but I do want to mention to people, because I didn't do it at the start, because we were behind. I want people to realize that there is an ILA strike going on. That's the International Longshoremen's Association. That there is a strike going on, and that it may cause a big issue with goods and services that our port use and get to us, in terms of supplies, whether it's food or whatever supplies we may need. And so I want our audience to be prepared to go to stock up, much like we did for the pandemic. Stock up and make sure you can survive to the best of your ability, that you can survive this strike at our nationwide ports, because goods may not be delivered in time. It's going to affect the supply chain. So go out, buy your grocery, buy things like you did when you were experiencing the pandemic, and so you can take care of yourself and your loved ones.
Thank you, Dr. Kane. In summary, maintaining proper foot care is essential, particularly for individuals with diabetes who face higher risk of complications. Key aspects of proper foot care include preventive measures like choosing the right footwear, daily inspections, and staying vigilant for early signs of issues such as ulcers or nerve damage. Regular podiatrist visits are crucial for those with diabetes or chronic foot conditions. Proper education, lifestyle changes, and proactive treatment can significantly improve foot health and overall well-being, reducing the risk of serious complications. Thank you, as always, for tuning in to Pause for the Truth. And please make sure that you subscribe to our YouTube channel. Tune in next week. And if you are in Florida or whatever state that you're in, please check your voting status, because the last day to register to vote in the upcoming presidential election here in Florida, it's October 7th. Check your state, check your voting status to make sure that you are ready to go. You're good to go. Thank you, as always, for tuning in to Pause for the Truth. Good night, everyone.
Now you see why you need to tune in every Tuesday at 6:30 p.m. Eastern Standard Time. It's been an absolute joy having you with us today on Pause for the Truth. Dr. Rogers Kane and Ms. Jocelyn Turner are so grateful for your time and support. We know you have a lot of choices, and we're thrilled you chose to spend your time with us. It means the world to us. A shout out to Tyrone Jackson of Call Tyrone IT Services for making everything run smoothly behind the scenes. Tyrone, you're truly a whiz. Remember, folks, we're here every Tuesday at 6:30 p.m. Eastern Standard Time with more insights, stories, and truths. So mark your calendars, set those reminders, and join us for another exciting episode. Thank you once again, and we can't wait to connect with you next week. Stay curious, stay engaged, and most importantly, stay tuned. Don't forget to like us on Facebook, link with us on LinkedIn, and most of all, subscribe to us on YouTube. Never forget to pause for the truth. Thanks for your support. Have a great evening. See you soon.